Greetings, good day. I am Loren Cunningham Hammond. I am one of the trainers here at National General Accident and Health. And today's topics we're going to be going over are the Access, which is a fixed benefit indemnity plan, as well as the Hospitalization Expense Protection Plus program, which was recently revamped. So it's a richer benefit offering. And again, that is a limited benefit hospital indemnity policy. So I'm just going to go ahead and get this going. So if you guys have questions, let me know in the chat and I will address them as we go. So today, we're going to be going over the fixed benefit indemnity plan, which is the NatGen Access, as well as some plan options. And then we're going to go into the Hospital Protection Plan Plus. It's the P's for me. They're catching my mouth today. Then we're going to go over those plan options as well as resources. Now, resources for you, the agent. I like to use this as a touch base to get a hold of your client and make sure they understand how to navigate our website. So why a fixed benefit indemnity plus plan? Well, 64% of Americans avoid or delay treatment due to medical costs and would, unfortunately, the prices of our healthcare are going up and up and up. And with that being said, 44% of Americans do not visit a doctor when they're sick or they're injured because, unfortunately, they don't know what that true cost of that medical visit is going to be. Unfortunately, 41% of Americans have problems with medical bills or debt. And unfortunately, a lot of that has been contributed to healthcare costs. So the fixed benefit indemnity plan is an affordable way for your client to get healthcare that they need. Now, please note, this can be sold in addition to a major medical, whether it's an individual, like an Affordable Care Act plan, a group benefit, or even a short-term medical. Please note, this does not replace any of those that I just mentioned. The fixed benefit indemnity plan is going to help cover anticipated costs for everyday healthcare services. It is going to pay a set dollar amount for certain covered healthcare services. Clients can and will be billed for any access benefit that this is not going to cover. So the fixed benefit indemnity plan that offers clients affordable and predictable access to healthcare. Clients can go to any doctor, any hospital, and receive a set benefit amount. No deductibles or copays are going to apply. Now, benefits for both the preventative and the unplanned office visits. We also have labs, x-rays, surgeon costs, plus a lot more, depending on the plan you opt for. Now, please note, no waiting period is going to apply for that injury or sickness benefits. However, there is a 90-day wait for preventative. So please note, I'm going to bring that up a lot. 90-day waiting period for that preventative benefit. So the Access is a great option for clients who cannot afford that major medical plan, but they want help covering costs and other, stuff that their other plans may not cover. It's going to help. We all need help paying for healthcare expenses at one time or not in our lives. Those deductibles are getting higher and higher, right? This is a great opportunity for you to bridge that gap for your insured. Access is not suitable for a client who utilizes a lot of medical services or needs an Affordable Care Act plan. Fortunately or unfortunately, whichever way you care to view this, there will be a health questionnaire on the application. So it is subject to the health questionnaire answers, but we do also offer a guaranteed issue. People want that comprehensive medical coverage. Now, for those that have a serious illness or chronic conditions like diabetes, this is not the plan for them. People that are typically eligible for that Affordable Care Act subsidy, again, not a suitable plan for them. So we're going to talk about the benefits as well as the network. Now, for the sake of being respectful of your time, I'm just going to focus on the enhanced, because you see that we have 6 different options: the value, the fundamental, fundamental plus, enhanced, enhanced plus, as well as the guaranteed issue. Now, for those of you that have clients with a health history, you know, you can still go to that guaranteed issue. Warren, will the slides be sent to us after the webinar? I am going to provide you with an email address that you can email me, and I would be more than happy to get those slides to you. So on the inpatient hospitalization, please note on the hospital administration, in the event your insured goes to the hospital and they are admitted, they will receive a $1,000 payment up to 10 admissions. Again, plan year here, guys. So on the anniversary of their plan, it's going to reset. So intensive care, in the event your insured is admitted into the hospital, they receive that $1,000 payment. But let's say that they go into the intensive care for that sickness. Well, they would receive a payment of $4,000 a day while they are admitted into that intensive care unit for up to 60 days, in addition to that $1,000 admission fee. It just keeps piling up. The money just keeps piling up. So keep that in mind. Now, let's say that your insured had to go into the intensive care due to an injury. Well, they would receive a $6,000 payment up to 60 payments or 60 days per plan year. Now, let's say that they had to have that healthcare practitioner visit while they were in that hospital. Well, they're going to receive an additional payment of $75, up to 10 visits per plan year. So again, inpatient hospitalization. So let's say that that insured had to be confined for said sickness. So they would receive a $3,000 payment per day on year 1, year 2, $3,750, and then year 3, $4,500. But please note, there is no maximum for that payment for 5 of the 6 plans. You'll notice that there is a limit on the guaranteed issue. So let's say that daily confinement on the injury. Again, you'll notice that the benefit is increasing from year 1, 2, and 3, $6,000 year 1, $7,500 year 2, and on year 3, it's $9,000, but the maximum benefit is unlimited. Any benefits paid for hospital observation only? That is a great question. And yes, Thomas, we do. So I'm getting there. So let's say that you're insured, you know, the one that went to the hospital, was admitted into the hospital and had to go into the ICU. Well, let's say that they had to have a surgery. Well, guess what? They're getting paid for that too. So in the event that they had a surgery, which falls under a tier 1. Now, I'm going to explain what a tier 1 surgery is. So let's say like amputation, excluding fingers, thumbs, toes, versus, let's say you have a young lady that went into the hospital, she's pregnant, she has to have a emergency cesarean section. If that is the case, complications, it's baby's life or mommy's life, then we would pay the benefit. Tier 2, I'm going to go into a little more detail. So let's just say on that tier 2, your insured would receive a $3,000 payment. And again, it is an unlimited benefit. Now, tier 2 is the more extensive surgeries, like that hip replacement, heart valve replacement or repair, spinal fusion. The list goes on and on. So it's, to me, it's the more serious surgeries out there. So again, more serious surgeries, tier 2. So let's say that you have to have, because your insureds come out of the hospital, but they still need to have an outpatient procedure. Well, we have a benefit for that as well. We have a $3,000 payment to your insured. Again, it is unlimited in the enhanced, but you'll note that on some of the other benefits, it's either unlimited or it does have a number of surgeries it pays per year. So again, that insured that went into the emergency room was put in the ICU because they had that injury and then they had that surgery. This is yes, per surgery, per surgery. Sanji, thank you very much. So let's talk about per surgery. Now you'll notice with the enhanced, because under the tier 1, it's not as severe on the surgery ratings. It is a $3,500 payment, but it is 4 surgeries per individual per plan year. The assistant surgeon has to come in. Again, because it's a tier 2, it's a more in-depth surgery, if that is the case, and they have to have the assistant surgeon. Some states like Oklahoma require an assistant surgeon in the operating room. If that's the case, your insured would receive a payment for $1,500, and that's 4 surgeries per year. Now, let's say that they have multiple surgeries at once, 2 or 3 different things are going on. We are only going to pay for 2 surgeries, and that is considered 1. Or if there's 4 different things that are being worked on, we only pay for the 1 surgery. Assistant surgeon for that outpatient is still a covered benefit, $1,500, again, 4 surgeries per plan year. Now let's talk a little more about that anesthesiologist. So in that tier 1 with the enhanced, again, a $1,500 payment to your insured, 4 surgeries per year. The anesthesiologist for tier 2, again, we're looking at 4 surgeries per year at $750 per plan year is the payment. Anesthesiologist for the outpatient, $750, 4 surgeries per year. Outpatient surgical facility. Yes, we do cover the surgical facility, $750 payment to your insured with 4 surgeries. So let's talk about the outpatient benefit. So outpatient, so that's office visits. So if your insured goes in for an office visit, you'll notice that it is a $100 payment, but the years increase. So year 1, it is 4 visits, year 2, 5 visits, year 3, 6 visits. Preventative office visits. Yes, guys, covered benefits. Again, after 90-day waiting period, it is a $100 payment to your insured for 2 visits per plan year. Urgent care facilities, your insured would receive a $200 payment, 4 visits per plan year. And again, 90-day waiting period for the preventative. Testing services as well as observation. I know observation are going to be a hot topic right now. So testing, radiology, and laboratory. In the event there is some radiology, your insured would receive a $300 payment for 2 tests per year. Laboratory, $75 payment. This is a maximum benefit per day of 2 tests, which is a maximum benefit of 5 tests per plan year. Now, please note the observation, which has been a question, is only available on the Fundamental Plus and the Enhanced Plus. What are the most expensive surgeries paid out less than the least expensive? I'm not understanding your question, Senji. Why are the most expensive surgeries? I'm sorry, I read that wrong. So the more expensive surgeries are paid out at a less dollar amount because typically speaking, if you are having an extensive surgery, you're going to end up in the ICU afterwards, and you're probably going to be in the hospital bed a lot longer than a easier surgery, the recoup. Does that make sense? Perfect. So let's talk about the emergency benefit. Yes, guys, we have a ground ambulance benefit built in. So in the event your insured has to utilize a ground ambulance, they're going to be paid $1,000 for one trip per plan year. Air ambulance, $2,000, again, one trip per plan year. And emergency room. So in the event your insured goes to that emergency room, they're not admitted, well, they're still going to get a $250 payment for up to 3 trips per plan year. Transitional care and prescriptions. So let's say that your insured has been in the emergency room, they were admitted, they had to have they were admitted into ICU. Okay, it happens. They had to have a surgery and, you know, now they need to recoup. But unfortunately, because of the times that we are in, they're trying to transition people as quick as possible. If an individual has to go to a skilled nursing facility, they will receive a $100 payment per day for up to 50 days. Again, this is per plan year. Now, please note, you can have a situation where an insured goes in and out of a emergency room surgeries multiple times a year. We keep a count of those days that are maxed out. So again, it's not 50 days and they've been in there once, 2, 3, 5 days, and that's the end of it. It's a total accumulation of 50 days. Home health care, again, $100 payment for 50 days per plan year. Hospice care is also covered, $100, and that is $50 a day, or excuse me, 50 days per plan year. Now we also have that outpatient prescription drug benefit. It is going to be per refill. So that is $25 up to 50 refills per plan year. We do utilize First Health Network. Now, the benefits of First Health Network are over 5,100 hospitals, over 110 ancillary facilities, over 695,000 professional providers. 96% of the US population has access to the First Health provider within a 20-mile drive. Discounts can go from 30 to 50% depending on the procedure. So again, we would urge that our client go to First Health Network because they're going to get those robust discounts. So let's talk about how this plan is going to work, additional coverages. So when I say 50 refills, is that on one prescription or just 50 prescriptions max? Great question. It is going to be 50 prescriptions max. Now remember, that is going to be the prescription that they receive from the hospital. So how the plan is going to work. So before the treatment, we would urge our insureds to use the network website and search for that network provider, firsthealthbp.com. Schedule the appointment with the provider. When they get there, they're going to present their ID card when they're checking into their appointments. So after they've completed their appointment, they're going to receive an explanation of benefit, which is going to show the member their network discounts and the plan benefits that were paid. If there is any billing, the member is still responsible for paying the remaining balance after the plan benefits are paid. Members receive the same plan benefits regardless of where they receive care or any provider. But again, we're going to urge our clients to go to that First Health to receive those robust discounts of 30 to 50%. So how the plan works when you're filing for the prescription. So let's say your insured comes out of the hospital and they have 2 or 3 different prescriptions and they need to refill those prescriptions. Well, not a problem. They're going to complete the prescription claim form, which is found on our website at natgenhealth.com/claims. I'll show you where it's at. They're going to submit the claim form with a photocopy of the prescription receipt and it must contain the drug name, the quantity, the prescription number, as well as the cost. So that generic receipt that you get at the pharmacist, that's not what we're looking for. We're looking for this white piece of paper with all the drug information on it. Okay. So let's talk about how this plan works. So Stacy was out walking her dog and she fell and unfortunately dislocated her shoulder. So she has a NatGen Access fundamental plan. She went to the ER and was visited she visited the ER, excuse me, and had that shoulder x-rayed. So that cost was $1,035. So network discounts, $390, because again, she stuck to the network. The ER benefit is $250 because remember, she wasn't admitted, and her x-ray benefit was $250. So luckily for Stacy, her out-of-pocket cost was only $145. So when I say 50 refills, is that one prescription or just 50 prescriptions max? That is going to be a maximum. So you can have 3, 5, 10, as long as we are refilling up to, we will only reimburse up to 50. I think I answered that. I apologize if I did. Life association, guys, we have life association. Depending on the state, it is a built-in product or it can be purchased separately. What are the benefits of it? Well, we have Telemed for Life. Telemed for Life, you can connect with a physician on the phone or video chat 24 hours a day, 7 days a week. No additional payment to your insureds. Unlimited. Unlimited wee hours in the morning, in the afternoon, as many times as they need to use it. No additional fees. We also have the hospital and diagnostic facility negotiation services, as well as discounts on the direct lab, lifeline screening services, financial empowerment platforms, active and fit. So your insured can choose from 9,000 different fitness centers for a low payment of $25 a month. Or if they want to do the active and fit from the comfort of their home, not a problem. They can do it from the comfort of their home. They have over 2,500 videos to choose from. Other discounts, Allstate identity protection, auto discounts, entertainment discounts, plus a ton more. So let's talk about the eligibility, state availability, limitations and exclusions, and then we'll talk about some of the enrollment information. So the primary applicant must be between the ages of 18 to 64 at the time of application. Yes, we can add a dependent child on the policy up to age 26, renewable to the month the client turns 65. So their 65th birthday month. If that is the case, we do also offer a over 65 indemnity policy. Requires clients to fill out a health questionnaire. Yes, guys, there is a health questionnaire, but don't worry, if they don't qualify, we still have that guaranteed issue as an option. Unfortunately, we do not offer a child-only policy. These are the current states in which the access is available in. Limitations and exclusions, this is just a generic for compliance purposes, but pre-existing conditions, dental procedures, elective or cosmetic services or surgeries, weight loss, chronic pain, pregnancy or maternity, workers' compensation, hazardous activities, mental disabilities, or chemical abuse. And that also applies to rehab, whether it's alcohol or chemical, like drug abuse. No California coverage, no Warren. No, unfortunately, it is not. California is one of those very fickle states. I'm hoping maybe one day eventually, but as it is right now. Unfortunately, it's not. I'm sorry. Is your pre-existing conditions for a year or forever? It is going to be it depends on the condition. If I will show you, Senji, where you can find the detailed information, okay? So, hospital expense protection plus plans. Now, forgive me if I stumble on the P's. I'm having a problem with them today, so forgive me. So we're going to go over why a hospital expense protection plan, the plan options, as well as the plan details, and then the resources. Now the resources, these are for you, the agent. So state residency based on tax filings or proven by utility bills. You can take any of these policies, any NatGen policy out in the state in which you reside. So some, I haven't seen too many people show tax documents. The only time where I've actually heard where people were questioned about the residency was when they had extensive claims. Typically speaking, with the claims department, you can show them a proof of your ID, your license, and that's pretty much establishes your residency, right? So why a hospital expense protection plan? Well, in America, the average cost of a hospital stay is $11,700. That out-of-pocket expense rose more than over 70% in the last 10 years for Americans, even with employer-based insurance. Guys, we're seeing the trends. We're seeing the trends, whether it's an employer, an individual, those Affordable Care Act plans, deductibles are getting higher and higher, and the coverage is getting smaller and smaller. So this is, again, another great option to bridge the gap of exposure for your client. Approximately 61% of Americans say that they would not be able to pay for $1,000 unplanned expense. Guys, we're living in rough times, rough times. Again, this is going to minimize the exposure for your client. Now, you can sell this hospital expense protection plan in addition to that other plan that we just talked about, the access. You can bundle any of our plans together. So we kind of sort of revamped the hospital expense protection plus plan. Now we revamped it so we have more robust offers. We actually have a couple of extra plans to offer. So it's going to be, again, a limited benefit hospital indemnity plan that is going to help your clients plan and to potentially save on those healthcare costs. So we have 6 plan options designed to meet your client's specific needs. So we have 3 base plans that help offset those costs of unexpected hospital stays. 3 max plans that provide benefits for hospital stays, along with a set amount of additional benefits for more common needs like office or even those urgent care visits. So this is going to provide a set cash benefit for, again, it has to be a covered service. Members are going to be paid directly on top of any other plan that they have. Clients are going to pay any charges in excess to the plan benefit. Multiple plan designs. It's also going to include a set number of benefits for intensive care, daily confinement, office visits, labs, x-rays, it goes on and on. Now, the beautiful thing about this hospital expense protection plus plan is there is no deductible or copay. Now, there is no waiting period or network restrictions. So let's talk about the benefits and then how the plan is going to work. And then we've kind of touched on the life association, so I don't really think we need to go over that again. So as you see here, we are super original with our plan names. We have the base plans, Plan A, Plan B, Plan C, and then we have the max plan, which is Plan D, Plan E, and Plan F. So for the sake of time, I'm just going to focus on the Plan B like boy. So in the event your insured had to go to the hospital and they were admitted into said hospital, they would receive a $3,000 payment, and that is one per year. Excuse me. Confinement for sickness, they would receive a $150 payment a day for up to 31 days per plan year. Confinement injury, again, $150 a day for up to 31 days per plan year. Now you'll notice that we do not have anything in the Plan B for ICU sickness or injury. The only plan that offers that is the Plan F. So again, focusing on Plan B, office visits, it's not going to be a covered benefit. They're not going to receive additional monies. Urgent care facilities, again, no payment. But in the event they went to the hospital and they were not admitted, but they were for observation, your insured would receive a $1,500 payment, and that's one visit per plan year. Radiology is not going to receive any benefit, or laboratory, but you'll notice that on the max plans, they are. So again, it depends on the plan. The plans you'll see is $50 on the max plan, D, E, and F. It is $50 to test for both radiology as well as laboratory. The emergency. So in the event your insured has to use a ground ambulance, well, they would receive a payment for $250 for one trip per year. Air ambulance, $25,000, one trip per policy year. And unfortunately, no emergency room unless you go with the Plan F. So how this plan is going to work. So Brandon was admitted into the hospital with pneumonia. He stays in the hospital for 3 days. Brandon has that primary medical plan with a $5,000 out-of-pocket limit and the AHCP plus Plan B. So the medical cost was $11,700. Now remember, his primary plan out-of-pocket maximum was $5,000. The AHCP hospital admission benefit was paid at $3,000, and the confinement benefit was $450, which is a total of 3 days. So his remaining out-of-pocket was only $1,550, which is a lot nicer than that $11,700, right? So guys, you can combine any of our plans, whether it's a plan enhancer, which is the accident medical expense with the optional cancer, heart, and stroke, or the SIP, which is a hospital sickness rider, Trio Med, cancer, heart, and stroke, which can also be in a standalone, Term Life, which can be a standalone or attached to our critical illness plan, the AccuMed, which is the accident medical expense with the accidental death and dismemberment, as well as our wide variety of dental products. We have dental indemnity, we have a PPO dental. Can you sell this as a standalone? Yes, this particular policy, the hospital Protection Plus plan, can be sold as a standalone. It is only a rider when it comes to the plan enhancer, an optional rider. So guys, we can write a policy from any date from the 1st of the month through the 31st of the month, but it could be as soon as like tomorrow if need be. The initial premium payment is any date between the time of the application, but it must be paid before the effective date. Recurring payments are 5 days before the monthly anniversary. So monthly anniversary, David sold me a policy, say for example, effective tomorrow. Going forward, any and all premium payment would be withdrawn on the 11th of the month. Acceptable forms of payments are EFT, so that's checking or savings account, Visa, MasterCard, or even Discover. So let's talk about the resources. I like this for you agents, and I also like this as a reason for you to touch base with your insureds. So if you go to our webpage, which is natgenhealth.com, you the agent, natgenhealth.com, you'll notice that we have shop insurance, existing customers, the agent and broker tab, as well as contact us or the quote. If you click on the agent broker tab, you have the following offerings. So agent tools and information. Hey, let's say you need a refresh on this access. Not a problem. Click on the agent and broker tabs, go to the agent tools and information, and you will find it'll show you our YouTube page. So if you need a refresher, not a problem, we got you. Marketing material, this is kind of the area I like to point out, spend a little more time with it. So this is where you're going to find plan brochures, flyers, as well as the trifolds. So the plan brochures, depending on the state and the product availability, this is where you are going to find that more detailed limitations and exclusions. And again, it's per state. You know, the Department of Insurance, they got their rules, right? So if that's the case, go in there, click on the marketing materials. Let's say you need the access plan for the beautiful state of Texas. Not a problem. Download the plan brochure. All the detailed information is there. Let's say you don't necessarily want the long and drawn out plan brochure. Not a problem. We have a condensed version with the flyer. Now we also offer a trifold. Again, you can download it. You can input your agency's information and you can email it or print it out. If you're one of those agents that sits with people across the table, this is great because you can print it out, hand it to them. Or if you're like most of us working from home, you can email the information again to your client. And again, this is where you're going to find that more detailed information on those limitations, exclusions, as well as the pre-existing conditions and limitations. So let's go to the existing customers tab. So let's say you need to find that first health provider, not a problem. This is also where I like to use this as a touch base with your client. Call them on the phone. Hey, Mr. Insured, let's make sure you understand how to navigate. So you need to find that doctor or a facility, Mr. Agent or Mr. Insured, go to that existing customers tab. Not a problem. All the information is right there. Click, click, click. If your insured needs general policy information for their account, again, it's going to be found here. Those prescription drugs that we were talking about earlier, well, they need to submit a claim, right? So the submit a claim form is found right here. It's super simple. Download the PDF and it literally gives you step-by-step instructions. Now, if your insured wants to view their policy, I highly recommend that they go to the My NatGen member portal. So let's say Gwendolyn sells me a policy because I have given her my email address during the process of the sale. As soon as she hits submit, I am going to get an email link. I am the customer because I gave her my email address. I'm going to view everything, make sure everything is copacetic, submit it with my e-signature. This is the member portal. So Gwendolyn would also get an email advising that it's been completed, it's been submitted. It's either yay, it's gone through, or not so much. If it goes into the not so much, we can talk later. But NatGen Health is where your insured is going to find those policy documents. If they need a temporary ID card, because currently we're like 10 to 15 days out with mail service on those ID cards. But let's say they want to use services as soon as tomorrow. Okay, not a problem, as long as it's not preventative, because remember, preventative is a 90-day wait. But again, if they need to utilize services, they need that ID card, right? Well, again, mynatgenhealth.com. This is a great way for you to touch base with your client. Let's say your client needs to update that payment information, or they forget their monthly anniversary. Again, have them log into the mynatgen.com website. Again, member portal, all the information is just right there for them. So a really quick recap here of the NatGen Access. It is a set dollar amount to help with those, unfortunately, costly healthcare costs. There is no lifetime limits. We have those 6 benefit levels, including a guaranteed issue. You can pick any doctor, any hospital, but we would like to urge our clients to stick to the First Health Network, because remember, they receive discounts from 30 to 50%. Easy to use and easy to understand. And then again, no waiting period on sickness or injury benefits. Really quick recap on that hospital expense protection plus set cash benefit that pay to top of, so in addition to any other, so if they have the access, you can sell them this. So we're going to pay them that benefit on top of all the other coverage. No waiting period, no network restrictions, any doctor, any hospital, and then 6 benefit levels, no deductible, no copays. And remember, Life Association member benefits are also available. So why NatGen? Well, we've been around since 1939. We were given an A+, which is a superior rating by AM Best. And we specialize in both the short-term medical as well as the supplemental insurance plans. Now, guys, remember, please make sure that your insured understands that the Access plan does not replace major medical. It is a limited benefit. So it is a limited medical plan that is going to pay a set dollar amount depending on the services. So please make sure that your insured understands that these are not part of the 10 essential health benefits. Now, guys, here's my email address. So if you have questions, you would like a copy of this presentation, please feel free to email me at the ngahtraining@ngic.com. So I thank you for your time. Have a great remainder of your day. Catch you next time.